Thank you.
Great. So great to have you here, Liat. And another thing about Liat you should know is she has exceptional taste in music, as I discovered last night. So yeah, kudos on many levels there. So just to kick things off, it's kind of clear from the statistics we're going to have the number of people over 80 are going to double by 2025 in the EU, apparently. So healthcare and public health are going to come under enormous pressure, and that's only going to get worse. But at the same time, there's great opportunities for health technology in improving the way healthcare is delivered and accessed. So what are your thoughts on how technology is going to help people access healthcare in the future?
So maybe I'll start with a personal story to kind of set the scene of why I think technology is really important in healthcare. 3 years ago in 2013, my son was born very premature, and we spent 3 months basically living in a NICU. During that time, he was tested every single day, brain tests, lung tests, blood tests, feeding, everything, and every single morning all the specialists would come together and they would compare all the results of how he was eating, how he wasn't eating, how his oxygenation levels are, what the x-rays showed, what the brain scan showed, and they would basically make a plan. I felt very comfortable, very confident. We had no idea what the hell was going on, although we were trying to follow. But suffice to say, everyone seemed to know what was going on, and it was... After about 3 months, they said, "Congratulations, you can go home." Well, on the one hand, I was ecstatic that what seemed to be impossible just 3 months before, he was healthy enough for us to take. On the other hand, I was completely frightened because I didn't have all those monitors at home, and how was I going to track all the things that they had been tracking day in and day out? So we went home with our son, and I downloaded like every single app you can have in 2013 for tracking babies. I used them all, and we were tracking the feeding and the bottles and breastfeeding and crying and peeing and pooping and everything. And over the course of the following year, he had a lot of difficulties, and we had to go to lots of different pediatricians, specialists, gastrointestinal specialists, nutritionists, neuro experts, everything. And every single time I went to a doctor outside the NICU, they had no clue about his history. And none of the doctors seemed to talk to the other doctors. All of the tests that one specialist did, the other specialists ended up doing the same. And we were constantly trying to connect the dots for these guys, going, wait, but why? The other guy said this. Why are you doing this? And the other doctor said this. And it was this constant struggle and fight to protect our son. At the end of the year, it was just frustration, anger, stress, and I don't think it needs to be that way. And so that, it's about how do we solve that? And I don't think my story is unique. Everyone I talk to has a story of their experience with healthcare or someone that they love, hospitalizations or chronic conditions that are really similar. And I think right now is a time with all the technology that's coming from mobile, from wireless, from the Internet of Things. There's so much information that we're getting. Let's take healthcare also to the next level. Let's combine that. Let's converge these innovations. Let's take healthcare out of the hospitals, and let's focus on the patient. Let's focus on the patient's family and really see how we can improve that user experience. I think there's a lot of work to be done, but I think the opportunity is ours for the taking.
Very good. So your kind of passion for improving healthcare is really driven by personal experience, which is really reassuring, I have to say. So in terms of the resources that you have at Philips and Philips Healthcare, where are you focusing your research and development resources in terms of IoT and connected healthcare?
So it's really about starting with the patient and then connecting the patient up to their caregivers, which sometimes is informal, like family and friends, and connecting them up to the professional healthcare provider. So really connecting up the pathways between all of these people who are involved in our health. But not only that, also connecting it up in different locations. So you're not always in one place. Your health happens to you 99.9% of the time when you're outside of the hospital. So how do you connect it up across hospitals and home and work? And then even in terms of time. So I'm not always sick, right? There's times where we're actually quite healthy and we want to have preventative health so that we don't get sick. There's times where we are being diagnosed and we want all the information to get the diagnosis right the first time. And there's times where we're being treated, right? And we need to make sure that the right treatments are being done for us. And then there's times where we're released from the hospital and we need to go home, but we want to continue that kind of care coordination between the hospital and the home. So over time, between the key people involved and in disparate places, how do we coordinate care? How do we create longitudinal records of our health so that better decisions can be made and better outcomes can come of it? That's kind of where we focus our innovation.
Excellent. And how do you see this is going to actually translate for consumers and patients?
So I think there's three things. One, I think it's going to change how we engage with healthcare. It'll change how we understand healthcare, and it'll change how we experience healthcare. If you think about engagement, like a lot of us are taking healthcare into our own hands. So we're trying to empower ourselves with healthcare. We don't wait for the doctor to do things to us. And you see this like with the quantified self, with wearable trends. Everyone wants to start to understand their own statistics and do something about it. In terms of understanding healthcare, and this is something I'm super passionate about, yeah, there's a ton of wearables you can download, and you can get a lot of data these days from everyone and their mother is making something that collects data on me. It's what you do with the data. It's not about the data, it's what you do with the data. It's the ability to interpret data in a meaningful way and make a better decision because of it. That's what matters, and that's what I mean by understanding. Can you use the data and connect it to clinical expertise to do something meaningful? And then the last, what I mean by engage, is kind of changing the way we think about healthcare from reactive to really proactive, from in-hospital to throughout my life. And I think it's, we're going to experience healthcare much more continuously, I hope, in the future, and that's quite a change.
Yeah, absolutely. Wonderful. And what will this mean for the end user experience?
I think it's all about user experience. I think every single thing that we do should be about the user experience, and mobile and IoT allows us to totally transcend user experience of healthcare because we can take healthcare into non-traditional settings, which, is actually effectively lower cost settings. But I don't think it's just about experience to lower cost. I think it should be about experience to improve outcomes, and then the side benefit will also be lower cost, which right now is the holy grail in healthcare, right? Everyone's trying to move to outcomes-based healthcare. I'll give you a couple of examples of things that we're doing. So we did a pilot in the US with Banner Health where they recognized that 5% of their population, usually elderly with lots of complex comorbidities, were driving 50% of the cost. And that's because once they were, released from the hospital, they constantly had problems and were readmitted back into the hospital, which gets really expensive. So we worked with them to create an e-care coordination program so that when these people would go home, they would have a bunch of trackers that would connect back up to the hospital. People can take interventions proactively. And what we discovered is, number one, people heal better when they're in their own comfort of their own home, right? A much more calm and comfortable setting. But it's not just about sending people home. That's not enough. It's about sending people home and making sure that they stay on the clinical protocols. So being able to have that tracking, that intervention. And number two, it reduced the cost. Like 27% of Banner's costs were reduced from that population because 45% of the readmissions were reduced. So there's real impact. Another example is what we're doing with elderly. So Philips Lifeline in the US does a lot with personal emergency response systems, so kind of a pendant. So if you want to have your elderly family member live more independently at home, they can go home with a pendant and have the peace of mind that someone is basically watching them 24/7, God forbid anything happens. And with that, what we're seeing is really, it's enabling families to have much more peace of mind, not just for the elderly person, but for everyone else in that family. And from all the data that we're able to collect, both from the pendants that are tracking movement, other things that are happening at home, like medication tracking, and connecting that up to EMR information of the patients, we're actually able to start to do predictive analytics for elderly who use Lifeline, where with incredible accuracy, we're now able to predict if in the next 30 days they're likely to need emergency transport. We might not know exactly what the reason is, but the likelihood to need emergency transport in the next 30 days, which allows caregivers to proactively step in and take certain actions. So really kind of changing the way we think about healthcare, but it starts with that user experience first.
Yeah, absolutely. Incredible use cases there. Now, you mentioned earlier that everyone and their mother is launching some kind of a fitness tracker, and there's been a lot of hype around fitness trackers for quite a while. Is there anything that convinces you that the industry is actually ready to leverage fitness tracking through IoT and mobile devices?
Yeah, you're right. In fact, there's like a bunch of things that you read these days that say 50% of the trackers and wearables that people have end up in the drawer. You guys have no idea how many things I have in my drawers. Because I use every single IoT thing out there. I have a lot of things in my drawers that I don't use. So, but I actually believe we're on the precipice of change. And the fundamental change is the ability to start to connect the dots between all of the data that we're collecting in these islands Because effectively, they're islands. You buy this device from this guy, and he has all your information in the cloud. You buy that device from that guy, he has all your information in his cloud. And none of this stuff talks. So I think what's changing is companies that are starting to recognize it's bigger than them and the importance of connecting information to hospital systems. And working with clinical expertise to make much more sense of the data, more than just showing me beautiful graphs. Because I have a lot of these apps on my phone right now where they collect a lot of information on my sleep patterns and everything. They show me these beautiful graphs, and I look at it and I go, what the hell? What am I going to do with this information? But connecting those dots and making it actionable is where things are different. I'll give you a couple examples. We, in our sleep and respiratory business, have developed a connected CPAP. So for people with sleep apnea, a lot of times they go home, they don't want to use a CPAP. It's uncomfortable or the stigma or whatever it is. And if you are on CPAP therapy and you don't follow the therapy, you're going to have sleep problems. And if you continue to have sleep problems, actually not sleeping can give you a lot of other problems, chronic problems over time. So this connected device allows a lot of education back and forth with doctors. You can tweak the program, optimize it for yourself. And they're seeing 22% increase in compliance to CPAP therapy using this connected device.
Wonderful.
Another example is what's happening right now with the Philips health programs. So there's like a connected health watch, connected scales, connected blood pressure, all the stuff that you're used to seeing. But the difference is that, first of all, they're all medical grade. And we're working with clinicians and doctors and behavioral change scientists to create programs so that based on the data that all this stuff is collecting on me, for people who are on the edge of getting a chronic disease, so that means you went to a doctor, the doctor said, listen, if you don't change your lifestyle by next year, you're going to have serious, cardio problems, or you're going to have some serious health problems. For those types of people, it's small steps, coaching, lifestyle advice to prevent you from actually getting a chronic disease. So really taking this stuff and turning it into very actionable, oftentimes clinical programs, I think that's where we start to change the game. From where I started with my child, we also recently released YouGrow, and that is, again, a medical grade service for parents to download onto their app where you can track all of the different things of your baby, feeding, crying, temperature, everything. And, we believe that with that, we can start to also connect up with hospital systems so that we can start to share with the doctors the information that we're collecting. When I was doing this in 2013 and I would show my app to my doctors, look, here's all the information of what we've been feeding him. He's been having a lot of problems. They looked at me like I was an alien. They looked at me like, why are you sure? I don't trust any data that you have on your phone. Like, this is not like I'm a medical professional. Don't show me apps. And so really to be able to cross that chasm, I think, is what's starting to happen.
Yeah, absolutely. There's a definite disconnect there. Now, speaking of which, reflecting on progress in other industry verticals, how do you think healthcare is embracing these changes?
They're conservative. They're conservative. I think it's a rightly regulated industry. But if you compare it to like the financial world, retail worlds, automotive worlds, things definitely are slower to adopt cloud technologies and so forth. I mean, if you think about it, every single person in this room, I guarantee, has entrusted their entire financial life to the cloud, right? You guys can go anywhere in the world and you stick your little card into a hole and you have access to money from any ATM in whatever currency. Like, we are fully in the cloud. For our financial well-being is entrusted to the cloud. But both patients and healthcare providers are not comfortable sharing health data and putting all that in the cloud and allowing these things, because data privacy is a really, really big deal in the health. It's one of the most sensitive, spaces. So there's a lot of concerns that I think we need to get over, and I think there's things we can learn from other industries, and there's a lot of focus in this area that needs to be continued.
Yeah, and speaking of which, in terms of innovation in healthcare, where do you focus?
Putting the user first, putting the patient first. And by the way, when you go to healthcare conferences, everyone says patient, patient, patient. It's about patient, 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 patient. As someone that comes from the tech background, it's not about patient. 99% of my life, I'm not a patient. When I leave the hospital, I'm not a patient. I'm a consumer, I'm a person. So putting that person first, whether they're a patient in the hospital or not. Open innovation. I'm a big believer in open innovation. and co-creation with customers. So we spend a lot of times with hospital systems, with insurance companies, with clinics. What are your problems, and how can we work together to solve those problems? Because no one company is going to come up with a solution on their own. It's really about co-creation in healthcare.
Yeah, absolutely. And kind of looking forward a bit, where do you see the sector maturing?
So I think there's going to continue to be more devices. Every single day, there's 50 more devices that I see on like Kickstarter, and a lot more devices, therefore a lot more data. We just get an inundation of data. We have more data than we ever had before, but we don't know how to share it, which is incredible. Even if you just think about within the hospital, EMR systems, right? We're still not sharing it. And we're going to start to figure out how to share. We're going to start to figure out how to deal with a lot of these privacy concerns. We're going to start to build, like Philips has built the Health Suite cloud solution, which is really an IoT platform for the healthcare vertical that tries to take into consideration the unique requirements of healthcare, like HIPAA compliance, data privacy, access rights, because not everyone should be able to access all of my data. I might want to give one person access to certain data and not others. So creating an open platform that a lot of different people can connect up to that address these unique concerns. And the biggest thing that I see in the future of healthcare is like a lot of the conservatism that exists today is because, you know, most of these healthcare systems and management have been doing it this way for a long time. But as a new generation of healthcare workers enters that workforce that are much more comfortable with the cloud and IoT and all the innovations that, you know, we talk about a lot here in this conference, I think you're going to see an acceleration of innovation in healthcare. So I think there will also be some generational changes.
Very good. Okay, exciting times. And final question, what advice would you give to any companies looking to leverage IoT for healthcare specifically?
You can't do it alone. So like one of the observations I have, and I talk to a lot of health tech startups that are doing amazing things, usually in like a vertical, right? They'll be doing something for Parkinson's, or they'll be doing something for diabetes, or they'll be doing something for stress and sleep. But they basically all want to create their own platform. They want to be the platform. So everyone, again, creates their siloed clouds. And no matter how fantastic these innovations are, you got to think of yourself, build yourself as a service that can plug into other people's innovations. That's how we're trying to build our solutions. We believe that our solutions will be better when we can hook up with other people's services. And we want innovators to also build their solutions to be pluggable, leverageable. Because my health problems will never be one thing. It's going to be the ability to kind of connect the dots across a lot of these different solutions and bring them together. I think that's really going to be the most powerful thing for the future of health tech.
Excellent. Well, Liat, thank you so much for your time. I'm really glad you are spearheading some of this change in health technology, and I think there's very exciting times ahead and great benefits for the consumer. So where can people find out more about your innovations around health tech? Is there a website they should visit?
Yeah, Philips.com. There's our healthcare area has all the different verticals of things that we're doing, and you can follow me at Liat Ben-Zur. I talk a lot about it on Twitter, and I'm hoping that next year we'll have a lot more women in the audience to share some of their stories also.
Amen. Thank you so much, Liat. Cheers. Please show your appreciation for Liat Ben-Zur. Thank you.
Thank you.
Great.